Hi, everybody. Thanks so much for joining us for today's panel discussion, Safety First, Collecting Data and Protecting People in a Global Pandemic. So I know a lot of people are still joining. I can see attendees sort of coming in, but I also know that many of you are busier these days than you've ever been. So I'm just going to go ahead and jump right in and hope that the people who join a bit later don't mind. So I'm Chris Robert. I'm the founder of Dubility and researcher myself. I'll be moderating today's discussion. So regardless of how our various political systems seem to regard the need for data, our public health systems, our education systems, our poverty and food programs, so much depends on data to function. And in turn, so many people depend on those systems and those programs. So for us here at Dubility, our initial response to the pandemic was focused on providing technologies and support to help our users adapt to lockdowns and the sudden impossibility of doing in-person data collection. So for example, like many of you, we pivoted to better handle telephone surveys, and you'll hear more about that today. And we're just now readying a release that will help self-administered web surveys reach more people more effectively in the right languages. At the same time, we've been preparing, as many of you have, for the day when we're all out of this kind of crisis mode and we're operating in something more like a new normal, one where we're not likely to run data collection projects just the way we used to, but we're also not likely to be 100% remote either. So fortunately, we've seen some great opportunities so far for technical overlap. So for example, we can use our new built-in telephone capabilities to allow field supervisors and field monitors to remotely accompany even in-person surveys in real time, rather than having to be physically present. But at the same time, we recognize that it's not all about technology. As much as some of us might like it to be, it's not even primarily about technology. So our Safe People and Data initiative is really meant to help pull together resources and lessons from the broader community to help all of us adapt our systems to balance this new need to keep vital data flowing, while at the same time protecting the safety of our staff, our partners, our beneficiaries, and overall the communities we serve. So this panel today is a great opportunity to discuss some of those resources, some of those lessons, with some of the people and organizations that are on the front lines of figuring out how to strike this balance. And I'm really eager to hand off to them. So I hope that you'll all forgive me for the extremely brief introductions. As you'll see soon enough, each of these panelists today brings a wealth of knowledge and experience to the conversation, and you can always stalk them on Google if you want to learn more. So our first panelist today is Maria Ruth Jones, a survey specialist at the World Bank's Development Impact Group. She and DIME have worked in around 60 countries and in partnership with hundreds of agencies. So she can speak to implementation challenges across quite a range of settings. Next is Lindsay Shaughnessy, who leads the global research and data support team at Innovations for Poverty Action. IPA has worked with over 600 academics to conduct over 800 evaluations in over 50 countries, and Lindsay's been there supporting a whole lot of that work. Then there's Tati Mukhopadhyay, who is the Associate Director of Research at the Poverty Action Lab in South Asia. There, she oversees a large and growing body of work in Bangladesh, India, Nepal, Pakistan, and Sri Lanka. Now, being responsible for directly supporting data collection efforts all around the world, Maria, Lindsay, and Tati are well positioned to speak from a research and implementation perspective. Our final two panelists can then help to round things out with more of a policy support and a partnerships perspective. So Davis Adieno is the Director of Programs for the Global Partnership for Sustainable Development Data, where, among other things, he helps to prioritize investments and innovations in data systems. Finally, Taylor Braun-Dorrell is a digital technology program specialist for USAID's Global Development Lab. So there, she's recently led the effort to develop a remote monitoring guide for USAID staff and partners, and she currently leads the implementation plan for the digital data collection mandate in USAID's digital strategy, which I think she'll talk a bit about. So it's a fantastic group. I'm eager to dive right in. Just a few quick logistics first. Thanks to all of you who submitted questions when you registered. Those will help us to kick off the discussion just after our panelists finish giving short introductions, but you can certainly ask additional questions here during the panel. Just enter them into the Q&A option in the Zoom window, and we'll do our best to work them into the discussion. Our team will also provide some written responses both during and after the event, assuming that we can't address everything in real time. We'll also take a few quick polls during the panel. So as you've seen, one has already popped up on your screen if you're using the Zoom app or the desktop client. We hope that you'll answer these questions to help us further the discussion. So this first question is about the most important things you need yourself to collect data more safely. And this would be for your projects or projects you partner with or support in some way. So since you've already had a chance to, I see many of you have already responded to the poll. Thank you very much. We're going to use this to bring some real data into the discussion, and we'll talk about the responses to these polls a bit later as we get into the discussion section. So with that, I'm going to go ahead and hand off to Maria, and I'm going to just switch over to her slide. So Maria, you can kick it off whenever you're ready.
Wonderful, thank you. And just to confirm, can you hear me well?
Yes.
Great. Okay, thanks. Hello, everyone. I'm delighted to be on the panel, and thanks very much to I look forward to the discussion and from hearing from all of the other experts. As Chris mentioned, my name is Maria Ruth Jones, and I work for DIME, which is the Impact Evaluation Department at the World Bank. Our global research program provides tailored impact evaluation services to government, and our portfolio, Chris, if you can.
Yeah, sorry, just 1 second. I'm just
no problem.
Just switching the display.
No problem. So let me just continue, and soon enough you'll see a slide pop up that shows our the sectoral and regional coverage at DIME. Just to say that we work across most regions of the world and across a variety of sectors, which and of course the portfolio has been dramatically impacted by the COVID-19 pandemic. And so an important focus at DIME over the past few months has been on thinking about how to transition our fieldwork and data collection efforts and how to develop protocols for safe data collection. So I'm really excited for the opportunity to talk more about what we've been doing and hear from other organizations about how they've responded. And a quick note, so if we can go, Chris, once you do get the slides up, if we can go to the slide on DIME Analytics. I lead a team at DIME called DIME Analytics, which is a centralized unit that's responsible for developing and standardizing protocols for high quality research. Compromise research quality, develop improved workflows, create and test tools needed for the adoption of these workflows, and then provide the training and technical support necessary to sustain adoption. All of the resources developed by DIME Analytics are converted into public goods through open source resources, such as the DIME Wiki, which you'll see linked here, and open access training, such as our Managed Successful Impact Evaluation Surveys, which is the course we recently completed that was open to the public and talking about some of the challenges around data collection and remote data collection. This team, the analytics team, has been really centrally involved in thinking about how to transition data collection, to remote methods, how to do so safely and continue to maintain high quality standards, and what protocols we can develop for thinking about, what the new normal looks like. How does data collection go forward even as fieldwork resumes and we think about adapting our current models. So if we can switch to the next slide, DIME's pandemic response was first to suspend in-person surveys everywhere. So in March, we very quickly halted all of our fieldwork, so both interventions as well as all data collection until, at that point, until further notice. And we made a lot of effort to shift to remote surveys wherever that was feasible. So thinking about shifting ongoing surveys that were in person to remote surveys. And I'll give an example of that on the next slide. We had successes in doing so across a few different regions and sectors. And then at the same time, we've been thinking about, what are the lessons learned from these early transition efforts and other remote surveys that have been done by our team in the past prior to this pandemic period, and what protocols come out of those for how we can think about safely launching new data collection activities going forward. Next slide, please. So to give an example, to try and hopefully make this all a bit more concrete. So as I mentioned, the first priority that we had was to shift any in-person data collection to remote data collection if possible. In other cases, we would just suspend. So one example of this is a market survey in Rwanda. And this is a long-term data collection activity that had been going on for a couple of years. We have an established team of enumerators that's making monthly visits to rural markets to collect information on the availability and prices of a basket of goods. So this data held really substantial policy interest, even particularly during the pandemic period. Our government counterparts were interested in understanding, what are the impacts of the virus and the associated lockdowns on rural markets, on food supply, on food availability. So we were keen to be able to continue this data collection, and so worked to revise the protocols to be able to collect the data through short interviews that would be appropriate for phone surveys. And in this case, we're fortunate to already have an established team of enumerators that made this feasible to transition. Next slide, please. But how we actually made this work, I think, is useful to think about in just a little bit more detail, because it digs into some of these questions around safety. And again, this was a very early experience. We did this transition in the end of March and early April. So as we started trying to do this, learned a lot about the gaps in the ways that we were thinking about remote data collection, and some of the technology tools that weren't really there. And I think those have really improved a lot over the last couple of months. I'll talk a bit more about that. So in this case, to be able to do this transition and to do it, think about revising our survey instrument and our interview protocols, shifting from one long interview where you just have an enumerator walking around the market and making observations to multiple phone calls with different traders and short forms that were all dynamically linked. So thinking about, using technology to be able to replace some of those in-person skills that would be there. And then also revising our protocols for handling PII data. So everyone's remote, thinking more carefully about respondent privacy, using numeric IDs rather than names as we are batting around tracking forms, and just a lot more data flying around than would necessarily be the case with face-to-face interaction. Instituted a fully decentralized structure, so there was no in-person interaction with the survey team once the lockdown was announced. And in Rwanda, the lockdown was both announced and effective on the same day, which left very little time to prepare. So we were able to do a fully virtual training, which we did via Skype and conference calls, and using test submissions and survey forms in place of typical mock interviews. Also contactless payments, both for our enumerators, but also incentives to respondents and reimbursements for airtime, so people had sufficient airtime for all of the phone calls. And as well, we took advantage of audio audits for quality control as a replacement for some of the in-person supervision. So all of those are tech features that we were able to take advantage of, and I'll talk at the end about some new technology that we're excited to be able to take advantage of from gaps that we realized in this. And also, as is really part of analytics, DIME Analytics' important mission is to document what we learn along the way and share that, so that we are creating knowledge and sharing our lessons learned openly in the hopes of being able to also learn from others. So we have a blog on our experience with implementing remote surveys under lockdown, and as well have a detailed article on the DIME Wiki about remote surveys with lots of resources and tips from our experiences there. Next slide, please, Chris. So now, so this was our early example. So first step was to shut down all field operations, think about doing remote data collection where possible. Now, as as the situation improves in some contexts, we're thinking about what are the protocols for resuming in-person data collection and beginning to restart some field work in some countries. So putting together protocols for that, and really we do think of this as being a new normal. So thinking about what data collection looks like in the post-pandemic period, even where we can restart field work, it will look different. And from our side, I think probably the most important difference is the level of decentralization. So really focusing on technologies and protocols that facilitate remote training and remote supervision to limit travel and to limit face-to-face. We provide impact evaluation services to government. And in some situations, we fund our data collection directly in support of the joint research agenda with government. But more commonly, the government is actually funding the data collection, and we're just providing technical assistance. So of course, in the first scenario, we're directly funding the data collection. We have a lot of control over exactly how that looks. And for that, we are developing modifications to our standard terms of reference to think about what are the required safety practices for firms that we'd be hiring to do data collection, and developing protocols for monitoring compliance. Where we're providing technical assistance to government, that decision to resume is not up to us. It's up to the local government. So we are simply providing technical assistance about how to do data collection in the safest way possible, given the context and given the type of data collection that is underway. So that's a challenge, and I think perhaps something that's worth returning to in the Q&A. So jumping to the next slide, I just want to conclude with some thoughts on looking ahead. So we're really pleased to see how much technology change there has been in the last few months to improve safety, and a lot of that's coming from Dubility side. So really a lot of kudos to them. When we started that first transitional survey in Rwanda, as I mentioned, we really struggled with some of the technology for remote training and thinking about how to do remote supervision. So I'm excited to see, more options with plugins for using embedded videos for training, survey forms, but also remote accompaniment in addition to the audio audits, which have their constraints. Also, I'm excited to see the privacy improvements that are coming up, such as field plugins that allow for masking phone numbers, especially as people are using of the constraints around the lockdown. And then finally, I think there's been already big improvements on the data security side. So things like having defaults for devices to remain locked, changing where data is stored. And on our side, on DIME's, we've been working on DIME's protocols for safe storage and secure interaction with survey forms, and have some revised protocols we put together that I've linked to here. And now what I think, though, we haven't yet seen, and I hope that we'll see similar levels of change over the next few months, is learning about field protocols as field work does resume. So some of the questions that we have in mind are things like, how do we ensure that safety measures and social distancing are actually followed in the field? And what are the repercussions if they're not? Those repercussions both for the implementer and for the funder. And then how do we think about things like social distancing impacting respondent privacy? For example, for very sensitive topics, usually you have a very, close conversation, one-on-one in a private space. That may be more challenging in this context. So thinking about that. Similarly with, things, measurements that involves really direct physical interaction, like weighing and measuring small children. Again, something we probably care about a lot to understand the food security implications of some of the lockdowns and of the virus itself, but very challenging to do in this context and to think about how to do safely. So that's something where we hope we'll see a lot of learning as people do resume fieldwork around the world. And finally, I think we're interested in, again, in also thinking about what are the best practices for informed consent as we go forward. And again, that is partly because we typically would do that by a signature or fingerprint, more direct interaction with the respondent than we want in this case, but also because, I do think we think about the risks and the benefits of participation in research studies potentially changing as there are within the context of the pandemic. So all of those are areas in which I hope we might hear more from other people on the panel about how they're thinking about going forward, but I think are also just open questions that we'll start to get more answers on as we go ahead. So with that, I believe I'm already at my time limit. So let me wrap up. But I, again, look forward to hearing from everyone else on the panel, and I'd be happy to answer more questions in the Q&A about DIME's experience and the protocols that we've been working on and developing.
Thanks, Maria. That's fantastic. And yeah, a number of the topics you mentioned for potential discussion overlap quite a bit with some of the questions we've seen. So definitely a lot to dig into during the discussion section. But for now, I'll just hand off to Lindsay. If you want to go ahead and unmute and share, it's off to you.
Can you see my screen and hear me? Yes?
Yes.
Okay, great. Okay, so Maria covered actually a lot of things that IPA is doing, so I'll try to stick to my time limit and focus on public goods that all of you can benefit from. So IPA has similarly pivoted away from in-person face-to-face data collection and is cautiously testing a new policy for resuming face-to-face data collection, and I'd like to share a little bit on both. My name is Lindsay. I'm the Associate Director of a team called Global Research and Data Support at IPA, which creates global protocols, resources, tools, and training programs for all of our country offices that operate around the world. So if you're not familiar, before the pandemic, IPA usually had about 200 field studies, mostly randomized control trials, conducting face-to-face data collection in about 22 country offices in multiple regions. And as soon as the pandemic hit, we launched an initiative called Research for Effective COVID-19 Responses, which consisted of a number of rapid response surveys in our country offices using a publicly available instrument. And all of our existing studies, if it was feasible, also shifted to remote data collection modes. And that meant rapidly building new protocols, including around our own IRB and data security resources and training programs. We ultimately have so far implemented about 60 surveys in 18 countries, whether it was new samples from random digit dialing or follow-ups from in-person baselines. And along the way, we also embedded methods, experiments, and phone surveys so we could learn as much as possible in partnership with the Global Poverty Research Lab at Northwestern, because we're fairly new to phone surveys, and this was a big pivot for us. And we're now at the point where we're cautiously testing our new policy for restarting face-to-face data collection. So in terms of outputs that might be useful to some of you on the call, of course, we'll stick to our status quo of publishing our results and making sure they're accessible. So I'll share our website, some screenshots in a moment from our Recover Hub, which includes ongoing studies, the results and many resources that you'll benefit from. But I also wanted to briefly mention, of course, I'll talk about in a moment, our policy for restarting face-to-face data collection, but something else we're piloting now that we feel is important is a set of tools and training programs for our field teams that we implement remotely that recognize the shift to phone surveys and to talking all day about the traumatic experiences during this pandemic, and to, facing a lot of rejection in the shift from phone surveys and people not wanting to talk. That's very different from in-person surveys, is that we wanted to elevate the importance of talking about burnout and vicarious trauma with our enumerators. So as for this Recover Hub that's publicly available on our website, a few things that people here might want to check out after this webinar are, I know these screenshots are small, but I didn't want to shift between windows during this webinar. So there is a database of projects, not only from IPA, from our many partners, including people on this call, where you can look up studies that are ongoing or completed, where they are, what kind of data collection they did, the results, etc. You can also look up the questionnaires that were used on those projects, and then as they come in, we share results in as many ways as possible. So for example, on our results page, this is the most recent screenshot that you can see. There's a nice webinar on the results from a series of studies on COVID-19 mobility and migration that we've done in partnership with YRISE in Bangladesh. So definitely check out this website. Another thing that I think would be beneficial is on the same website, the Recover Hub, there's a resource page that has a number of things that I'd like to highlight. One is a handbook on remote surveying that summarizes our practical recommendations so far on how to run remote surveys. It's about 40 pages, but it's very wide-ranging in what it covers, from should you run a phone survey, sampling, infrastructure, hardware, software, field protocols, training, call codes, scheduling, and SurveyCTO, case management, quality controls. So if you're feeling overwhelmed by the idea of setting up phone surveys or even just data collection, not as part of research, you should check that out. And it also links to our GitHub page where we share resources, not just about phone surveys, but that includes SurveyCTO forms and a number of other SurveyCTO-based tools. And then finally, if you're new to phone surveys as well, there's a research synthesis of a fairly comprehensive evidence review we did of studies that had employed remote data collection modes in the past, like IVR, SMS, or phone surveys, because we had so many questions ourselves about things like costs, response rates, representativeness, and sampling frames. And so we wanted to help people not go in blind with the research and questions they were designing. And so we're starting to have evidence come in on things like descriptive analysis of whether random digit dial surveys undercount women. And you can see that the numbers change very much by country. And I'm happy to talk more about this later on in the panel. We don't have a lot of time here. And then we're also embedding methods experiments. So experimental analysis helps us see in different countries, and again, these are preliminary results and the differences are not statistically significant right now, but it's really helpful to know whether things like pre-survey messaging helps improve response rates, and the difference here is between an appeal being about different things. So pivoting quickly, I also want to mention that IPA has shifted our policy on restarting face-to-face data collection. So the guiding principles here, of course, are that we want to prioritize the safety and well-being of our participants, staff, families and communities. And while it's very important to IPA that we be part of the crisis response and contribute to it, that also means for every project weighing the risks and benefits. And part of how everything is changing so often every day with this pandemic is that any system to manage this has to mean continually updated approval and monitoring system. So what we've put into place is we have a policy, and all of this is publicly available. Again, I want to focus this webinar on things that you can learn from. We have a full publicly available policy on returning to fieldwork that you can read in a blog post or the policy itself. Then we have a dashboard where you can see for all of our country offices what the status is and the likelihood that a project would be approved to conduct face-to-face data collection there. Then you have to submit an approval forms and actually detail information about how you plan to address the pandemic. And finally, we have a checklist to help you make sure that you're thinking about the right things. So this policy discusses the flow for approvals and details each of the steps, and that's publicly available. The first step is reviewing this country status dashboard, which I linked to in the end of my presentation. It automatically takes in data from the European CDC on cases per day, 3-day average, case doubling rate, and cases per 100,000 people. And then we use a number of sources, including our own country office staff, as well as a number of safety and security resources to make updates on government restrictions and subnational outbreaks. So a red status means that you have to have a really strong justification and security protocol or safety and health protocols to justify a project, and it's not very likely that it would be approved here. Yellow means there might be some subnational outbreaks. You have some chance of getting approved. You still need to apply. Currently, we have no green countries. That doesn't mean you don't need to apply, but it means that things are looking up. You still need to apply, but you have a good chance, and we've already approved projects in this country. Currently, the only yellow countries are Malawi, Rwanda, Zambia, Burkina Faso, Liberia, Mali, Sierra Leone, and Myanmar. This is the application form, which asks you for your individual project to talk about how you're going to address any government restrictions, notifications of adverse outcomes, what your IRB looks like, how you're thinking about incentives, PPE, physical distancing, health protocols, transportation, risks and benefits. And this is meant to give senior and regional leadership a way to truly weigh the risks and benefits of whether it's worth it to conduct face-to-face data collection for your project. If you're approved at that level, then we have, again, a publicly available resource that's quite long and comprehensive of a series of protocols, both required and recommended. If you are conducting face-to-face data collection that every project needs to complete before actually launching that data collection, on everything from sick leave policies, referral protocols, public transportation, group size, protocols if symptoms appear, training outdoors, outside of places with outbreaks, and there's really quite a lot of information there if you'd like to check that out. So where we go from here, of course, we're going to start implementing, we have implemented and are testing this policy. We do plan to continue with multi-mode data collection even after the pandemic passes, especially for high-frequency snapshots of things that can help us with, for example, recall bias. It might not make sense to use baseline and end lines to ask about agricultural labor, for example. And if we can do these longer surveys, but then call weekly or monthly to ask about agricultural labor, then these multi-mode data collection efforts work for us. We'll continue to think about mental health support and embedding methods experiments. And finally, we just had a data scientist join our team a few weeks ago, and we're working through all of this new data that we have from phone surveys, and we're excited about the idea that we could potentially use our wealth of ground truth data about survey data quality to potentially build a machine learning algorithm that helps us predict data quality using survey paradata. And there are a bunch of links here, and thank you very much.
Thanks, Lizzie. That's awesome. Yeah, a whole lot there. Luckily, a lot to explore on the website, but we can dig in a bit more in the discussion as well. So without further ado, I'll hand off to you, Kati.
Yeah, I'll just share my screen. Can you see my screen?
Yep.
Great. And can you hear me okay?
Yep. Perfect.
All right, great. So let me just take a step back and start by saying, firstly, a very big thank you to Chris and the SurveyCTO team. We have been working very closely with you guys for a very long time, but I think in the face of this pandemic, the technological collaborations and just collaborations in general with network organizations has been a fantastic knowledge sharing and learning experience for all of us as we sort of band together and fight this pandemic. Let me start by saying that one thing that this pandemic has done is to bring the science and technology at the forefront of both decision making and action. As all of you know, JPAL South Asia is one of the offices of JPAL, which is an evidence to policy organization. And what we've seen is whether it's vaccine development or experimenting with different strategies in spreading crucial information related to COVID-19 symptoms or any sort of preventative measures such as encouraging social distancing, hand washing, and so on. In South Asia, we've seen policymakers and practitioners as well as funders relying on data, rigor, and technology. So what this has done for all of us is it has shown how the landscape has changed extremely rapidly from the demand side of things. And evidence to policy organizations like ours is sort of in a position to match that with high quality supply. Over the last few months, what I've realized is that, working with SurveyCTO, closely collaborating with IPA in terms of resources, sharing knowledge and practices has brought us to a very interesting internal strategy. So I'm going to start with that. So what I'm going to take you all through is what JPAL South Asia has learned over time or is learning over time. When the lockdown began, we sort of immediately halted all field work. We had like close to, I would say, 41 projects on the ground across about 16 states in India, and we decided to take a step back and think about how we were going to respond to this pandemic. As time went by, we realized that we had to update our beliefs and move forward and start looking at a little longer, future timeline. So you will see that, of course, so we've broken up how we are going to deal with the pandemic in terms of research and data, and also informing policy and decision making into 3 categories of respond, recover, and reset. Of course, the learning and the response time has been the largest for us. We are still focusing on, I think, immediate steps to keep people safe and continue essential research. So with essential research, I think there are a couple of things that I want to point out here. We had gone ahead and halted like all field research, and all organizations on this particular panel have done that as well. But what we had to be mindful of is once this pandemic was over, certain research questions were going to become even more pertinent. So we had to do everything in our capacity to make sure that we continue essential research that might just become more pertinent after the lockdown, but also to support research to inform decision-making in the face of the pandemic. And what we saw, of course, a lot of innovations, a lot of resources were built as a positive externality. In the recover phase, right now we are, inching towards that. We are, working towards building resources. We are working towards, steps in which we can deal with the new normal. And in the reset phase, of course, hoping that whatever we've learned from the respond and recover phases will result in durable and lean infrastructure to support future research and decision making. To give you all a little bit of idea in terms of how we are working, we have operations going across 9 states in India. We have a targeted sample of over 100,000 people that we are, going to reach or are almost have reached. The average survey duration that we are looking at is less than 30 minutes, of course. And this is mostly I would say the average could have been closer to 20 minutes, I think, as Maria had put in her presentation. But the sample that we are dealing with, a lot of them are the elderly, so it takes a little time for people to adjust to phone surveys as well. In terms of what research areas we are working with, this is sort of like the broad category. So we are collecting data on COVID-19 response. We are collecting data on healthcare delivery, behavior change and communication, migration and migrant conditions, cash transfers, economic shocks, government relief, mental health and well-being, knowledge, attitude and practices, as well as education. As you can see, all of these categories are either things that we need to respond to and immediately need to take care in South Asia, or which will become extremely pertinent in the future. For us, our partners have mostly been governments, and I'll take you through the learnings in a bit, but what we found is working closely with partners has sort of, pushed the, evaluation and evidence, critical aspects into solving these issues. Quickly moving on from responding to this entire pandemic, just taking you all through this entire larger landscape that we are dealing with right now. Internally, we had to do a lot. And I think this is one thing that I would love, and I hope this panel will discuss this fairly soon, but internally, organizations had to realign and re-strategize and reprioritize a lot of things. To make a successful pivot, what we found is that we had to coordinate a lot with internal as well as external stakeholders, especially on how we transition or adapt and deliver. So through all of the COVID-19 response research that we've done and the kind of data collection that we've continued, the projects that have been able to transition to fully remote data collection, our learnings can be categorized into sort of three buckets. This is more from the broader aspects of learning and not just resources for now, but in the next couple of slides, I'll take you through what kind of resources that are being built by the JPAL team as well. So firstly, on the research, data and technology part of things, I have been working in this field for close to 8-9 years now, and what I saw was a very, very rapid shift. Of course, from the safety perspective, the data collection modality had completely changed. But what came with it is the changes to the data flow infrastructure itself. As Lindsay was mentioning right before we began the panel, right now we are sort of working towards remote training sessions, and what we see is quite a rapid change in terms of what data flow used to look like when we used to do in-person data collection, and the kind of constraints the remote working constraints have put on both security and monitoring. We had to develop a lot of resources and protocols to change, to support this change in data flow. Everything from how we hire, how we train, different kinds of innovations in how to decouple different parts of trainings, how to monitor, what kind of composition would work the best when you look at an enumerator supervisor ratio. How could we leverage, things like audio recordings, back checks, what happens to spot checks, accompaniments, so on and so forth. The other thing that we saw, and this was absolutely a new thing that we saw in JPAL South Asia, the researchers started thinking differently in terms of how they would be responding through their own research. We saw a very clear shift away from deep touch community-based interventions to technology-dependent designs and delivery mechanisms. For example, we recently concluded one part of a massive large-scale project in the state of West Bengal, where I think a lot of you might have seen the paper that has come out, but we sent messages to over 25 million people and try to see how behavior change campaigns can be broadcasted at a a scale as large as 25 million. It was extremely light touch as an intervention as compared to anything that we've done in the past. But in terms of impact, it saw far-reaching significant impact in terms of behavior change along the lines of mask wearing, hand washing, and social distancing. So that's a very clear change that we are seeing. We also saw a lot of changes in the choice of sampling techniques, given that there was no ready-made sample for researchers to immediately shift or gain access to shift to phone surveys. We saw a lot of researchers actually opting for data pooling as well as things like snowball sampling. The other thing that we learned was that remote training is really hard. It's difficult to, if you have a large survey team, training people remotely is going to be extremely difficult because you don't really know how many of them are paying attention, how they are dealing with technology. A lot of them haven't used things like Zoom and Skype and Google Duo in the past. But what we learned is, and we learned it a little bit of the hard way, but what we learned is it's important to decouple and modularize your training materials to build in tests and quizzes so that you're constantly checking, mock interviews, just to get people used to the kind of technology that they are going to be using. Moving on, viability and impact. I think this has been extremely critical and will be of interest to a lot of people on the panel as well as in the audience. But all of these changes have a financial impact. So we also undertook like a financial analysis of all the research that we were running and try to look at what the new normal costs would look like if we, pivoted to the changes in the data flow infrastructure. Second, as Lindsay mentioned, it was a fantastic dashboard that she showed in terms of where return to field is going to be viable moving forward. That is something that needs to be constantly monitored, and we've undertaken that. In terms of people, a couple of things, of course, at the top of our mind is always ensuring the safety and security of our staff and communities. But the second thing, something that we deeply feel about, we were able to, South Asia was able to provide wage security for an extended period of time for all our enumerators. And like I mentioned, we were working in more than 15 states at that point in time, and we had close to about 1,500 boots on the ground, and we were able to provide them wage security for an extended period of time. Moving on to look forward, again, within the same categories, I would say we are currently working on a bunch of resources. We are of course, having a lot of conversations with organizations like IPA, EPOD, but just trying to understand how the standard operating procedures will need to adapt to the new normal. So we are building checklists and protocols around hiring, training, budget accommodations for PPE, participant safety, general safety protocols for shared spaces, escalation mechanisms, and how we can conduct regular centralized oversight. We will also be providing bespoke advice to researchers as they gear up. Like I mentioned, viability and impact, I keep harping on this, but it's going to be extremely important to constantly keep thinking about the financial impact and viability of these solutions, as well as the geographic viability of wherever we are working, because while ramp up itself has its cost, ramping down research on the ground will also have a significant impact both on finances as well as partner relations, people safety. With the people aspects, again, ensuring the safety and security of our staff and communities is going to be primary as we look towards the future. But from the other aspect, I think one thing that I do want to highlight, while we all are working towards, looking at how we can return to field fairly safely, we need to constantly be mindful of the fact that the continuation of our work should at no point in time increase the risk burden to the communities that we work in. So of course, looking towards ethical bodies and public health experts is going to be a very, very important thing. Okay, I'm going to stop now.
All right, thanks so much. Yeah, there's definitely a lot for us to cover, but luckily a fair amount of overlap also. So we'll go ahead and shift over to more the policy and partnerships perspective for a minute, but just first two quick things. One is I did want to mention that we will be sharing both the recording of the webinar and the slide decks and hyperlinks after the webinar. So you don't have to worry about that. I know a lot of links and different things are sort of flying by here. So we'll circle back and email all of you with all of those materials in follow-up. And also, I wanted to have one more quick poll, so we have a little more data to work with during the discussion section. That poll is just for those of you who did have ongoing in-person data collection work going on when the pandemic hit. We'd like to know just how the pandemic affected those operations in summary. And if you didn't have any ongoing work going on when the pandemic hit, please just sort of skip this one and don't respond. So with that, I'm going to go ahead and hand it off to Davis. You can unmute yourself and take it away.
Thank you so much, Chris. I hope you can hear me clearly. There's a bit of a storm brewing where I am in the background, so it's certainly got a bit dark. But hopefully no, you can see me. Thank you so much, and wonderful presentations there by my colleagues. My name is Davis Adieno, Director of Programs at the Global Partnership for Sustainable Development Data, which is a global network that brings together over 260 partners, primarily concerned with how data can accelerate progress on sustainable development, the SDGs, and many other development frameworks. I would say, when the pandemic hit, and of course, in Africa, where I'm based, there was an immediate scramble because, at the time, governments didn't know exactly, what types of data sets would they need, to respond to the pandemic. Of course, the focus was on, the security of the countries, ensuring that different mandated institutions like the Ministries of Health, national statistical offices and others would coordinate. So set up a coordinating mechanism that then allows the governments to work with multiple stakeholders to ensure that the fight against the virus, as soon as it enters into countries, would be effective. We launched an initiative called Data for a Resilient Africa, in partnership with the United Nations Economic Commission for Africa, and this was in April this year. And the idea really was to think about how member states across the region in Africa could be effectively supported, to access data, to access statistics, to access information, have the partnerships that would then allow them to access the resources that they actually needed to combat the pandemic or manage it if it's already in the population. And of course, we've been working with an amazing set of partners, many of whom are part of the GPSDD network, who've been, some had a presence in the region for many years, already working with governments, and everybody had to stop whatever it is that they were doing to basically focus on the pandemic. So in a nutshell, we've reached out to about 45 countries across the region with consultations in about 40 countries and 34 countries actively being engaged at the moment. We've brokered partnerships in around 21 countries across the region, having introduced these different countries, different institutions within the countries to a lot of different supply side partners who are providing data and information on either population, health facilities, looking at mobility patterns, identifying vulnerable populations, etc. And of course, thinking about the economic impact. So I would say that the pandemic did disrupt a lot of data collection exercises, and our engagements with national statistical offices brought this to bear. Offices had to be shut, and now that brought in a lot of other challenges because people were not set up to work at home. So if you're locked in at home and you have no access to the internet or to a computer, so to the ordinary government official, these were extremely challenging times. But at the same time, a lot of the national statistical offices we engaged in the region had to think fast. And the first instinct was to look at what it is that they actually have within their system. So either survey data or census data or whatever other resources they could lay their hands on. And then figure out who else within the data ecosystem could deliver certain types of data sets. And then the other challenge was, a lot of the decision makers at the executive level were looking for actionable information. So the decision points, what are you look at the profile of the entire population, where are the vulnerable populations, what are the mobility patterns, how are people moving from those areas to others, and how does that almost immediately inform either lockdowns, curfews, etc. There was an automatic, going back to existing data sets, etc. But also we've seen increasingly now a resumption of data collection, mainly looking at trying to conduct analysis on the economic impact or looking at vulnerable populations, either children, the elderly, etc. And a lot of the support that's being provided across the region through the UN system is also looking at how now countries can use either computer-assisted personal, interviewing or use mobile devices, etc., to collect data sets that would then provide snapshots of what's actually happening within the population. And I would say the other big point was the aggregation of multiple sources of data. In other words, it was not enough to look at, the population or survey data and derive the right information from that. So a combination of where the population is and looking at mobility patterns, for example, using, for example, in Ghana, the Ghana Statistical Service, Vodafone, and Flowminder already had an existing partnership that was looking at how mobile data, CDRs, or call detailed records could actually be used for different purposes. And that particular project was almost immediately reoriented to look at real-time mobility patterns and informed decision-making in terms of how people were complying with the lockdowns and the curfews. So I would say this is going to be the future. So you cannot, on the other hand, I totally agree with colleagues who are saying we cannot eliminate, certain types of services, surveys, censuses, etc. But we'll have to rethink about how those are actually being conducted. And of course, to do that, we need partnerships with citizens, and ensure that citizens also become data collectors. So looking at other sources of data like citizen-generated data, looking at mobile data, looking at Earth observations data, etc., and combining that with the traditional sources of data is going to be a way of the future, because you get near real-time data that you can then validate with existing data sets. But to effectively have these partnerships, you need an effective governance framework. In other words, people are concerned about the security of their data, who's actually accessing it, who's using it, and for what purposes. If you are to use personal data, especially for decision making, then of course we need extra layers of security. We need the data to be in the hands of trusted people. But even with that, you still need a risk mitigation strategy that ensures that in case something actually happens, then as an institution or organization, you're able to quickly swing into action and mitigate that. So in a nutshell, I'll say, we have to pay much more closer attention, in sectors that data, it's not enough, to have the data, but we have to look at what the data is pointing us to. In which case then, the COVID-19 has really taught us there are certain core pillars of sustainable development without which you cannot survive. Health, agriculture, nutrition, etc., and other service industries that we have to look at. And then the frameworks for collaboration are the other area that we have to critically look at. If we're going to create incentives for new models of public-private partnerships, largely driven by social impact coming into play, then we have to think about how we can aggregate capacity, think about how we can, empower different partners. And this is something that we are actively doing with a lot of countries right now. There's an extra layer of capacity building that comes with every support. And this is demand driven because countries are saying, yes, it's good to work with a particular technological partner, but we want to see how best we can do it ourselves when it comes to data collection, data management, and of course, data security and many other factors. And then I'll conclude by saying that a lot more investments really have to be made, both technical, technical, financial, policy, and regulatory in data governance frameworks, because ultimately, without that particular framework that allows different partners to work together, even if you're looking at the whole data collection process and the whole data value chain process, then that particular framework and the rules that govern that are going to be absolutely critical in creating an enabling environment which ensures that data is protected, at the same time it's achieving maximum impact in delivering the kinds of insights that can be used for actions that then promote livelihoods and of course safeguard other interests. Thank you so much.
Oh, thanks so much, Davis. So I see a lot of questions have been queued up. Thanks to everybody who's answered the polls. But before we dive in on the discussion, I'll just hand off to you to wrap up the introductions. Taylor.
Great. Thanks so much, Chris, and thanks to all the other panelists, and thank you to all the participants who are listening. This is such an important conversation. I'm really excited to be here. So my name is Taylor Braun-Dorrell. I work in the Center for Digital Development at USAID, and our focus is incorporating the responsible use of technology into our programs. And we work to collect and share best practices with our staff in the field and with organizations that we work with. Myself in particular, I lead the work on digital data collection as a part of the agency's digital strategy. And that led me to developing a remote monitoring guide this past spring with a colleague of mine, which really worked to think through what some of the issues were that our staff and our partner organizations were facing in collecting data in the middle of a pandemic, which all of you know, we've heard the previous presentations, we're all on the same page. So I'm going to focus a lot on my portion today to talk about responsible remote data collection. At USAID, remote or monitoring data in general, now remote monitoring of our programs and the context we're working in is really important to understand not only how our activities are progressing and the needs of the populations we're working with, but also to see changing needs and adapt our programs as we go. However, data collection does come with some risks, particularly for vulnerable individuals and groups. And so this current situation adds an additional layer of complexity when it comes to collecting data responsibly. So there are a lot of questions on how to do this. So my team a year or so ago put out a guide on considerations for using data responsibly, and it provides a framework that's very simple that basically says when we're collecting data, we want to maximize the benefits and minimize the risks. And while this is very simple, I think this is where we should always start when we're thinking about data collection, and particularly for remote data collection. So today I'm going to focus on 3 main points. To help you remember, it's going to be A, B, C. So the first point is to ask yourself a few simple questions. The second point is going to be to build upon responsible data practices. And the third point is collaborate and share knowledge. So I'll start off with asking a few simple questions. Everything in my presentation is back to basics. So in the past spring, when I was asked to develop this remote monitoring guide, a colleague and I were basically told that we needed a guide that would be across sectors, across countries, and across different data types. So not only do we collect monitoring data for our programs and context monitoring data and research, we conduct research as well. So there was like a lot of different variables, and we needed everyone to start off on the same page. So we asked ourselves, okay, if we were thinking any person who's working with USAID and any organization, where should we start when it comes to remote monitoring? So we started off with kind of a question and answer. And the first question, again, very simple. What do you need to know? As a lot of other panelists have mentioned, and as all of you know, moving from a face-to-face survey to something remote, particularly via mobile phone, like an SMS data collection or telephone interviews, you really need to limit the number of questions and the complexity that you're getting at. So really thinking through what is absolutely necessary for you to collect right now is the first step. Second step, how can you get this information? In our guide, we also talk about some big data like call detail records, satellite imagery, remote sensing. But for the majority of the organizations we're working with, they're going to be collecting data from an individual, likely by mobile phone, probably by either phone survey or SMS survey, or in some cases, interactive voice response. But this brings up another set of questions around mobile phone access and use in the areas that you're interested in, and particularly amongst certain populations. We know that women are less likely to have access and use of mobile phones. Similarly, older populations use mobile phones less than younger populations, and people with disabilities and people with lower literacy levels interface with mobile phones in different ways. So when we're considering using a remote data collection tool, we need to really think about who might be missing out from any of these data collection efforts and consider how this might bias our results. That doesn't necessarily mean we shouldn't be using mobile phones to collect data. It just means that we're working in a suboptimal situation. We need to think through a lot of these issues before we choose some sort of remote data collection tool. So the second point is to build upon responsible data practices. So responsible data collection is always important, but it's even more essential during a pandemic. And that's probably because decisions need to be made very quickly, and that can amplify the tensions between data needs on one hand and privacy and security concerns on the other. So while remotely collecting data, we need to really ensure that we're still obtaining informed consent, that we're emphasizing the privacy and security of data, and that we're considering the risks around collecting potentially sensitive data by phone. One example that we've heard from some of our partners, and maybe some of you have experienced this, is that families often have shared mobile phones. So if, for example, you wanted to reach out to women to see how they're impacted by COVID-19, and like many of our partners, you might have a mobile phone number for one of your beneficiaries, but when you call it, you might reach a male family member like her husband. This doesn't necessarily mean that you can't still collect data from a specific individual in a family, but we do need to think about the privacy concerns that this brings up and how comfortable people are going to feel responding on a shared phone, and particularly in a shared space. And again, when we're trying to collect something that's potentially sensitive, for example, like medical information or health information, we really need to think about any risks and work to minimize any potential harm that could come to our respondents because of our data collection. The last point I'm going to talk about is collaborate and share knowledge. This is not the first time in-person data collection has been disrupted, and it definitely will not be the last. So sharing knowledge, like for example, this panel, and particularly I want to give a shout out to a lot of organizations that have been publishing guidance or case studies on how they're working. That's really critical, and that's going to be helpful for us to continue in the future. But I'm going to recommend to take it one step further and collaborate on data collection efforts wherever possible. And one of our missions, USAID Ethiopia, has a great example of this. When the pandemic hit, they were obviously implementing a lot of their projects on food security, which is one of the main issues that USAID works on in Ethiopia. And they had to stop or pause a lot of their implementation of the project. But they still wanted to understand the impact on food security and socioeconomic indicators in the areas that they were working. So what they did is they developed a community of practice with other donors, our NGO partners, and the World Bank, and they would have regular check-in calls to coordinate these data collection efforts. They started harmonizing their data collection by adding a small number of new questions to phone surveys that were already being conducted. And then they shared these questions across different organizations to reuse. And the organizations that already had collected beneficiaries' phone numbers through their activities were able to move really quickly. They identified the percentage of beneficiaries they had contact numbers for in different areas of operation, which allowed this community of practice to interview a subset of those beneficiaries across the country. So if one organization wanted to do this, they might get one small piece of the puzzle. They could probably interview a few people, understand a little bit, but by coordinating across donors and different organizations working in the same country in the same sector, they were able to see a much fuller picture, which will assist them to really hit the ground running when they're able to continue working. So I think while COVID-19 does represent this massive challenge, responsibly collecting data using remote tools doesn't have to be. Obviously, the data collection methods are not going to be perfect. You're going to run into challenges. There are definitely going to be issues, but we can work to make the data we collect as beneficial as possible while minimizing risks to our respondents and enumerators within our current constrained working environments. So I want to say thank you again to our organizers for having me and for all of you for listening, and I'm really looking forward to the discussion.
Great, thanks so much, Taylor. So that was fantastic. If we were in person, this might be the time when I suggest some kind of energizer where we all jump up and down and get blood flowing. Please feel free in the privacy of your own homes to do this. But we'll go ahead and jump straight into the discussion. So first, I wanted to go ahead and share some of the results of the polls. So I'm going to share the second one first. So you'll see this now. This was the question about for those who had data collection operations that were ongoing when the pandemic hit. And I think just one, nothing here is too surprising. I think to us, maybe for some of you, I'm a little bit surprised that so many people say they've already resumed in-person operations. I think that's fantastic, and all of us will be looking to learn from those of you who have already resumed. We see a lot are thinking about resuming over the next couple of months, and of course, some have just canceled projects altogether. Which makes sense. Let me go ahead and see if I can share the second poll, or the first poll rather. So here, this was the first poll on what participants here today feel they most need in order to collect data more safely. And I think here it's interesting. I mean, obviously, so 75% of people say that they need more guidance on remote data collection methods. And I think, we've talked a fair bit about that already today. A lot of resources are becoming available. We can talk a little bit more in the discussion about that. But then obviously there's a lot of interest also in specific guidance on making in-person data collection more safe. And also this potential for, I think Ruth at ID Insight had sort of challenged WHO to issue internationally accepted guidelines for safely resuming data collection, viewing it as a sort of international public good. So clearly there's a fair bit of interest in potentially international guidelines, whereas as opposed to each organization having to sort of go it alone in terms of defining protocols and guidelines. So to kick off the discussion, I think what I'd like to think about first and talk a little bit about is, each of you have mentioned shortcomings of remote data collection methods, including, Taylor, you were just mentioning who we might miss, privacy concerns, survey length or complexity. There are a number of shortcomings that have come up. And so, despite all of this interest in remote data collection methods, there are some cases where it works fine. Lindsay, you mentioned short, high-frequency surveys, but I wonder if each of you could just give a couple of brief examples of where you're most keen to resume in-person operations, where essentially some degree, some non-zero risk is worth it, given some combination of the inability to collect that data well using remote methods, or the potential value of that data. So does anyone want to jump in with any sort of concrete examples of where you're most eager to resume in-person work? Lindsay, I see you've unmuted, so I think that's a good sign.
I can just mention, I think what would probably be common across many of our organizations here are that we work with a lot of populations that have limited access to phones, move quite a lot, and so we're really trying to work especially with populations like migrants and refugees, particularly Rohingya refugees in Bangladesh. So we're quite eager to figure out a safe way to do that work. We're doing it remotely now, but Bangladesh is not a country that is ready to resume face-to-face data collection right now, at least under our protocols. And then similarly, even in populations that are less likely to move around than migrants and refugees, we still do quite a lot of targeting of populations that might not have electricity or phones or air times and move to remote villages. And so I think that's probably a common thing across our organization.
Okay, great. And Maria, I see you've unmuted. So do you have a couple of examples to share?
Sure. So to briefly add, I mean, I think much like Lindsay said, the priority areas for us for resuming in-person fieldwork are the contexts where the sample is going to be hard to reach by mobile phone. So that could be an issue of phone ownership, but also the concerns brought up earlier about who are you reaching in the household, and are they, you know, at liberty to speak freely? And that ties into the second point, which is the type of data that's being collected. So thinking about, you know, sort of sensitive data, for example, if we're interested in questions around, you know, domestic violence and whether there are any implications of, you know, of lockdown or movement restrictions on that. That's one where it would be really hard to potentially to do by mobile phones surveys. So I think those are the two main criteria for us are thinking about, you know, what is the sample for the what is the population of interest for the research question? Are they going to be accessible by mobile phones in the context that we have? And then what is the nature of the data being collected? And is that feasible to do either in a short format or, you know, given the sensitivity of the questions, is it possible to do by phone? So those would be the kind of key considerations from our side.
Great. That's fantastic. And yes, it's an important sort of feasibility concern, this issue of the sensitivity of the questions. I know that's come up a few times, but it's really a non-trivial thing. You may be technically able to ask these questions over the phone, but you may be very uncomfortable with the potential respondent side risks that are sort of going unobserved as you're conducting that interview. I'm sorry, I think Davis, I saw you unmute.
Yes, thanks, Chris. And just to quickly mention that as an organization, we definitely don't collect data, but we do work with a lot of partners who collect data. And of course, for many of them, the short-term surveys and impact assessments are going to be a key priority. And that's something that's coming up across nearly all the countries that we are engaging in. And now how to conduct that, obviously, is part of what we've been discussing today. But again, this new normal actually means that a lot of capacity and knowledge transfer, skills, mentoring, etc. has to happen. And all the work that the amazing partners on this panel are doing in terms of generating resources that can provide guidance, guidelines that can support countries remotely to effectively do this. We as an organization, together with ECA and many other partners, are working on a capacity building a strategy which looks at not only COVID but post-COVID, but pretty much working with partners, established partners, organizations, institutions that have been doing this for a long time, who already have materials and would be, so our engagement to the country partners is basically to identify where the needs are, surface those particular needs, and then do a bit of matchmaking with the partners who have the materials or who can provide support. Obviously, for certain areas, if you're to access call detailed records, etc., some of that work is going to be quite difficult to do remotely. And I'm sure, a lot of the partners engaged in this particular area would be keen to move, in country and work in close proximity with the mobile network operators and many others. So there are certain types of data sets that it's going to be quite difficult to access remotely, and we have to think about, what are the modalities of making that happen in practice. Thanks.
And Tati, I see you're unmuted as well.
Yeah, so I just very quickly wanted to add one thing apart from whatever Lindsay Davis and Maria have said. At JPAL South Asia, we work with a lot of vulnerable population, and one that seems to stand out in this current situation where I think the suspension of field activities is going to impact, the respondents and participants even more are individuals that require psychosocial support. So partner organizations that are working with individuals with this kind of need are interventions that provide with mental health, try to look at improving mental health outcomes. These individuals probably will be impacted the most. And I think that's one place where I think the suspension of field activities might just be more problematic as compared to the larger, greater good of keeping everyone safe. So.
Oh, that makes sense. So, and you had also mentioned, it's come up a few times now, financial impacts. And Taylor, I don't want to pick on you, but certainly being attached to sort of the largest donor organization represented here today, I just wanted to drill down a little bit. We've seen a lot of questions on costs, and I think everybody recognizes that the not only the transition itself to more remote methods, but the transition to safer data collection methods, even when in-person resumes. There are sort of one-time transition costs, and then there are ongoing costs. Data may have just become a lot more expensive, and that may just be the bottom line. And so I think there's a lot of interest out there in kind of how donors are thinking about the degree to which they'll help foot the bill for that, or sort of reduce their asks to projects in terms of reporting, impact analysis, that kind of thing. So I wonder if you might kick us off with any thoughts on the sort of cost side of everything we're talking about here.
Yeah, sure. I'll start off by saying I'm a technical expert, not a contracting officer. But what I can say is this is something we're constantly thinking about at USAID. So I mentioned that this past year, we released our new digital strategy, which encourages, obviously, the agency to understand that we're living in a very digitized world, and we want to be able to promote an open, inclusive, safe digital ecosystem in the countries that we're working in. And my role in that is a part of the digital strategy, which recommends that our partners move to the greatest extent possible towards digital data collection, which comes with, like you said, a one-time cost of like investing in, not one time, but like an upfront investment in hardware, potentially software, and training. But also we understand that data needs to have, there are costs around keeping, data private and secure. So we've already been thinking about a lot of these problems even before the pandemic. And my role as kind of a technical person is to work with our partners and understand what those costs are, what they look like, and potentially how this shift might affect organizations differently, and then bring that back to the agency to socialize it. So we're working a lot with different parts of the agency to ensure that they understand the costs associated. So our activity managers, our procurement people, all throughout the agency. And this is there are 16 different work streams, I think, or 17 of the digital strategy. So we're thinking about this all across what these things are going to cost. And we're socializing that now within the agency. Obviously, that does take some time. So what I always recommend, or what we recommend, is partners working with their activity managers or their contacts within donor agencies to explain upfront and really brainstorm together what the costs are going to be over a project, or potentially what the cost could be to shift to remote data collection, and then see where the mobility is within, obviously, this current situation. USAID has been really thinking about how we can adapt our programming and support our partners to move to remote implementation and monitoring. So definitely this is a conversation that we're still having, but it's something we're really trying to socialize, particularly my center within USAID, and I know other donors are doing the same.
And I'm very curious from those of you who have been on the implementation side and have had to take essentially fixed budgets and just do what you can. I'm curious if you'd be willing to share kind of how you're approaching the costing and sort of funding side of everything that you're doing here. Maria, I see you've unmuted, so that's you volunteered.
Sure.
Or not.
So I have two quick points. Let me start with just not exactly the question you just asked, but related closely is that I think we had at DIME already in the last year or two really been pushing more towards using administrative data and other types of data as well to complement our survey data. And I think the pandemic has only catalyzed that. But it's not to minimize the importance of survey data. And in fact, I think going back to the question about where it's most critical is really, in helping us to use alternative data sources as well. So thinking about using survey data to ground truth some of these other types of data that we're trying to use, whether that's called detailed records to look at mobility or social media or any of that. So just to say, and that also is really closely related to the question of costs, because it is sometimes more feasible to acquire some of this administrative data or kind of sensor data than it is to do survey data, or it could be, and it can be require less face-to-face interaction. So that's something we're really thinking about a lot at DIME, and how to do that safely and how to think about that in combination with our survey work, and particularly as we look at the costs of at least traditional in-person face-to-face surveys going up. I would say that we have not found that transitioning to remote surveys has been more expensive. I think it's been pretty cost neutral because in some way it does require effort on our part for transitioning protocols and instruments and figuring out kind of the best ways to do this, but the actual costs are lower because in my experience, field costs are the drivers of survey costs. So transporting field teams around and paying, kind of per diems to field staff are huge bulk of budgets. And so when you're removing some of that by keeping people in one place and having them make phone calls, it's not dramatically less expensive, but it's somewhat less expensive. And I think that's but resuming in-person field work feels like it will imply increased costs. And so thinking about ways to do that is a different challenge.
Mm-hmm. Anybody else want to talk about particularly this idea of telephone surveys, remote methods, perhaps being expensive, but certainly it does seem like resumption of in-person activities is going to be more expensive than it used to be. But I don't know if anyone's gotten kind of a handle on that. I know some of the specific questions people asked have been around PPE and other overhead for new protocols that people might be putting in place depending on the setting. Okay, I'll take Tati.
Yeah, so I just wanted to add to what Maria was saying. So for us as well, I think two approaches have really worked. One, definitely working with researchers to see if there are any complementary data sets that can be used in lieu of primary data collection. But most of our work depends on primary data collection. This could be one particular time where we are pushing the boundaries and seeing how administrative data can be used as a substitute. To what extent can it help us? But to actually, even if some percentage of our projects actually move into in-person data collection, our initial, I would say, back of the envelope calculations tell us that it's not just going to be, of course, the safety kits, the PPE all of that can be factored in. There is a cost associated with that, which can be projected, budgeted, and taken care of, which is going to be useful for answering donor, informing donor conversations. But there is so much that is still uncertain. Like I mentioned right during my presentation itself, that, right now we are thinking about the ramp up cost, but given the disease epidemiology, it's difficult for us to predict what the ramp down cost could look like, if it's going to need to be double counted, and so on and so forth. So there is a lot that is uncertain, and it's difficult to put a dollar value on that. Yeah.
Mm-hmm. Okay. So great. So thanks so much for that. I think, unfortunately, we're running out of time quickly here. Seeing the range of questions, a lot of them are very, very specific, to suggestions about specific protocols, everything in terms of, questions about random digit dialing, or, other tactics for remote surveys, response rates. Fortunately, just about all of you have fantastic resources on the website. We've been trying to collect many of them on our Safe People and Data website. And so what we'll do is we'll go ahead and collect responses to most of those questions, or all those questions, and in particular link you to the appropriate resources. I think that'll be better than us running 3 hours overtime on this particular webinar. So we'll send an email in follow-up to this. I just want to take a moment to thank again all of the panelists for taking the time, and also for all of you who joined us today. So a huge thank you, and we will follow up with you about how to keep the conversation going and other resources in the next couple of days. So thank you, everyone, and stay safe.